Hey Mindset Community, Dr. Ellen here, coming to you today with your next Tire Talk. So we are down on the ground because we are starting part 2 of your breathing section, okay? So just a little bit of a review. We're gonna start laying on your back and we're gonna go over some of the diaphragm and abdominal breathing to try to get you using most of your tissues in a more efficient way so that we avoid some inefficient and pain-causing movement patterns. So let's go ahead and drop right to it. Let's go ahead and lay on your back. We're gonna put your knees up in the air. Hands are gonna be down at your side, all right? So when we take this first breath in, you should feel your diaphragm drop and your abdominal area begin to fill a little bit with air. Your lower rib cage is going to expand, and you should even feel a little bit of your back push down into the ground. So let's go ahead and try a couple of those. I sometimes like to keep my hands on my lower rib cage to make sure I'm actually expanding in there so that I'm not just kind of pooching out my stomach. All right, so let's go ahead and take a breath in. So let's feel that abdominal area fill with air, our lower rib cage expand, and just really start to hone in on that low back and see if you can feel that expand as well. And then take a couple more seconds and start to hone in on that clavicular area or that neck area, and just make sure you're not doing much activity up there. That should be pretty darn quiet. That's not an effective area to breathe with. That's something that I struggle with quite a bit, especially when I'm tired, like right after a workout, or if I'm excited about something, or if I'm nervous about something, I tend to breathe quite a bit up there. So that's something I always have to keep correcting myself and practicing. All right, so one last time, breathing in and breathing out. Good. So now we're going to add another layer. So we've kind of talked about the top with the diaphragm and some of the surrounding tissues in the abdomen and into the back. But what about the bottom? That is your pelvic floor, okay? And that area is directly linked, both neurologically, fascially, structurally, you name it, to your breathing. So it's really important if you don't have good breathing techniques, that's going to throw off your ability to regulate and control and synchronize with your pelvic floor. And the other thing happens where if you've got issues in your pelvic floor, it affects your ability to breathe more normally, because if you think this area can have a lot of pressure in it. So if you don't have a stable pelvic floor and you're worried about any sort of pressure pushing down into it, well, guess where you're going to breathe? You're going to breathe up here in that neck and shoulder area, and that's not an effective place to be putting your breath. So this next time when you breathe, you should actually start to hone in on your pelvic floor and feel it soften and just a little bit relax. It's going to come down a hair when you breathe in. It should mimic what your diaphragm does. So you have your traditional breathing diaphragm, but your floor is very similar to that diaphragm. So as you breathe in, that pelvic floor should relax down, and then as you breathe out, you should feel it come up. Okay, so we're going to take a couple breaths in. Feel that pelvic floor drop just a little, and then as you breathe out, it should rise back up. Good, very good. So what I want you to do in the next week is try to connect a little bit more with your pelvic floor. Whether you're a male or a female, doesn't matter. We need to understand the connection and the overall health that happens when this is in sync. Okay? As you get really good at this, you can then start to add other layering factors like different sort of pelvic floor contractions and such. But as of right now, we're just going to work on the breathing, control, and relaxation of that pelvic floor now added into your diaphragm breath. All right? Good luck. Have a great week, and we'll see you next time. We love you more than you know.